Who is more likely to get breast cancer and how to reduce the risk of breast cancer? Breast cancer can affect anyone, but certain factors can increase the likelihood of developing the disease. Here's a breakdown of who is more likely to get breast cancer and tips on how to reduce the risk. Who is more likely to get breast cancer? 1. Gender. Women are much more likely than men to develop breast cancer. However, men can still get breast cancer, though it's much less common. 2. Age. The risk of breast cancer increases with age. Most breast cancer cases are diagnosed in women over 50. 3. Family history. Having close relatives, mother, sister, daughter, with breast cancer increases the risk. Certain inherited gene mutations, such as BRCA1 and BRCA2, also increase the risk. 4. Genetic mutations. Inherited mutations in the BRCA1, BRCA2, and other genes significantly increase the risk. 5. Hormonal factors. Early menstruation, before age 12, or late menopause, after age 55, increases the risk because of prolonged exposure to estrogen. Hormone replacement therapy, HRT, involving estrogen and progesterone may increase the risk, especially if taken for several years. 6. Personal history. If a woman has had breast cancer in one breast, there's an increased risk of developing it in the other breast. 7. Radiation exposure. Previous radiation therapy to the chest, especially at a young age, can increase the risk. 8. Lifestyle factors. Alcohol consumption. Drinking alcohol regularly increases the risk of breast cancer. Obesity. Being overweight or obese, especially after menopause, increases the risk. Physical inactivity. Lack of exercise may increase the risk of breast cancer. How to reduce the risk of breast cancer. While it's impossible to prevent breast cancer entirely, there are steps that may help reduce the risk. 1. Maintain a healthy weight. Staying at a healthy weight, particularly after menopause, reduces the risk of developing breast cancer. 2. Exercise regularly. Physical activity can help reduce the risk, particularly for postmenopausal women. 3. Limit alcohol consumption. Reducing alcohol intake or avoiding it altogether can lower the risk of breast cancer. 4. Breastfeeding. Breastfeeding for several months may reduce the risk of breast cancer for mothers. 5. Healthy diet. A balanced diet rich in fruits, vegetables, whole grains, and lean proteins may help reduce cancer risk. Avoid excessive intake of processed foods, especially those high in unhealthy fats. 6. Avoid hormone replacement therapy, HRT. If possible, limit the use of combined hormone therapy, estrogen and progesterone, after menopause. Talk to a healthcare provider about risks and alternatives. 7. Regular screenings and early detection. Regular mammograms, especially starting at age 40 or earlier for those with a family history, can help detect breast cancer early when it is more treatable. 8. Genetic counseling and testing. If you have a family history of breast cancer, you might consider genetic counseling and testing for mutations like BRCA1 or BRCA2. If you are found to have these mutations, your doctor may discuss preventive options, such as more frequent screenings or preventive surgeries. 9. Avoid radiation exposure. Limit unnecessary exposure to radiation, especially at a young age. Though these strategies can lower risk, they don't guarantee that someone won't develop breast cancer. Regular checkups and screenings are key for early detection, which significantly improves the chances of successful treatment.